Hello everyone, welcome to the today's video of hypoparathyroidism. Here we see how hypoparathyroidism occur by various mechanisms and what clinical manifestation can we see in hypoparathyroidism and various other things in relation to the various diseases which results in hypoparathyroidism we are going to see here. So let's begin. Hypoparathyroidism is very less common than hyperparathyroidism, but that may be surgically induced. That means if any person is suffering from hyperthyroidism, then that undergo removal of the thyroid gland. So in that process, parathyroid gland may also be removed unknowingly. So that may also result in hypoparathyroidism, and that is called a surgically induced hypoparathyroidism. And other things that can happen is the person who are suffering from hyperparathyroidism that are undergone for a removal of the large portion of the parathyroid tissue, so that person later on may suffer from hypoparathyroidism. So this is the concept of surgically induced hypoparathyroidism. And autoimmune hypoparathyroidism is that come up with association with other chronic autoimmune disorders like the chronic mucocutaneous candidiasis and primary adrenal insufficiency, and this syndrome is known as APS1 and often caused by the mutation in autoimmune regulator gene. And next is autosomal dominant hypoparathyroidism. So what happened? There is a mutation in the calcium sensing receptor, and this is a rare cause of familial parathyroid adenomas. So inappropriate calcium sensing receptor results in a failure to the formation of parathyroid hormone, and that results in hypocalcemia and hypercalciuria. We know that parathyroid hormone has role in calcium homeostasis, and once that is not produced um, in normal amount, then that may result in hypocalcemia by reducing the uh, rate of bone resorptions as well as impaired reabsorption of calcium from the renal tubules, but it may result in hyperphosphatemia due to increased reabsorptions from the renal tubules. And a familial isolated hypoparathyroidism, so that is a rare condition, and that is either autosomal or autosomal dominant or autosomal recessive. And if it is dominant one, then there is mutation in the parathyroid hormone encoding gene, and that impairs the parathyroid hormone processing to the mature active hormone. So if mature parathyroid hormone is not produced, then that also results in hypocalcemia and hypercalciuria, since the function of parathyroid hormone will be reduced, or the target organ may not receive the parathyroid hormone for their metabolic activities. And also in the recessive one caused by loss of function mutation in the transcription factor gene GCM2, and that also results in familial isolated hypoparathyroidism. And next we see congenital absence of the parathyroid glands, and this happens when other congenital defects are present in an infant or in an adult, and it come in association with various congenital defects like as thymic aplasia. If it come with the thymic defect, then that is called as a DiGeorge syndrome, and this may come off in conjugation with congenital cardiovascular defects, or as a component of 22q11 deletion syndrome. And this condition is a DiGeorge syndrome when the thymic defects are present, that we said earlier. And the clinical features mainly manifest is the effect of the hypocalcemia. We know the major effect of hypoparathyroidism is hypocalcemia. So severity and chronicity of the condition results in the various manifestation is the um, result of hypocalcemia. Like the hallmark of hypocalcemia is tetany that has been characterized by the neuromuscular irritability due to decreased calcium level in in the plasma, and also circumoral numbness or paresthesia, tingling on the distal extremities, and carpopedal spasm, laryngospasm, and generalized spasm. Seizures may also appear in the patient, and it's very rare that life-threatening laryngospasm and generalized seizures appear. If it happens when the um, hypoparathyroidism become more severe and chronic, in that condition, life-threatening laryngospasm and generalized seizures appear. And various mental, issues can be manifested as emotional instability, anxiety, depression, confusional states, and so many others. And also, uh, cataract can be appeared in those person who are suffering from this hypoparathyroidism and due to the calcification of the lens, and there is a paradoxical association of the hypocalcemia and this calcification. Though the calcium level is very low, but still calcification is happening there. But how this happens? This is because we know that the calcium level is low, but the plasma phosphate level is increased. So this phosphate level will trap the calcium, and that calcium phosphate will be deposited at the target site, resulting in the calcification. So this is the paradoxical association between this calcification and hypocalcemia in case of the hypoparathyroidism. And the cardiovascular manifestations are like the prolongation of the QT interval in the ECG, and dental abnormalities as dental hypoplasia, failure of the erection, defective enamels, and so many other things can be appreciated. And intracranial manifestations like the calcification of the basal ganglia, Parkinsonian like movement disorder, increased intracranial pressure with resultant papilledema. And this is a paradoxical association with uh, calcification of the hypocalcemia. The classical findings on physical examination that we can see in hypoparathyroidism are chopstick sign and torso sign. Chopstick signs that when we tap the facial nerve just anterior to the ear, then we come to know that lateral or the same sided facial muscle will be contracted, or twitching of the facial muscles at the same side will occur. And this if this twitching is happening, then that is called as the positive chopstick sign, and that indicates neuromuscular hyperexcitability most associated with hypocalcemia, and also seen in hypomagnesemia and after thyroid surgery that may damage to the parathyroid gland as well. And torso sign is that the blood circulation to the distal arm is occluded by inflating the blood pressure cuff, and that results in carpopedal spasm, that is flexion of the wrist and the metacarpophalangeal or knuckle joints, and hyperextension of the fingers. That is produced by the occlusion of the circulation to the distal arm by inflating a blood pressure cuff to suprasystolic pressure for several minutes but not exceeding the 3 minutes. And pseudo hypoparathyroidism that results from the resistance of the end organ to the parathyroid hormone. There is no any defect in the formation or processing of the parathyroid hormone, but it happens due to resistance of end organ itself to the parathyroid hormone. And serum parathyroid hormone levels are normal or either elevated in pseudo hypoparathyroidism, and that come up with other resistance to, like indargan may be resistance to some other hormone as well, like TSH and FSH or LH, as well as parathyroid hormone, which work by the G protein coupled receptor signaling pathway. So resistance may happen in these receptor like G protein coupled receptor. So if there is resistance or mutation in such receptors, then indargon will be resistant not only to the parathyroid hormone but also to the thyroid stimulating hormone, and follicle stimulating hormone or luteinizing hormone, so many other hormones that work by the G protein coupled receptor. So that may present as, so such person who are suffering from the pseudo hypoparathyroidism, so that may present hypocalcemia, hyperphosphatemia, and elevated circulating parathyroid hormone. And if the person is resistant, if the end organ of that person is resistant to TSH, then there will be a mild manifestation. But if that person is resistant to FSH or LH, then the person is female, then that manifests hypergonadotropic hypergonadism, since FSH LH resistance is very much visible in case of the female. So if the patient suffering from pseudo hypoparathyroidism has a resistance to FSH or LH, and yes, it is a female, then hypergonadotropic hypogonadism can be seen, and this is a very severe condition. This much for now. Thank you.